ophthalmologist. There we go, said it
That's
correctly.
right. That's
Perfect.
right.
And we are here to talk about cataracts. So we asked a few of these questions on TV, but let's go ahead and run back through them for the people that are just going to join us now on Facebook Live. So if you want to start out by just kind of telling me what exactly is a cataract?
Right. So a cataract, again, is the natural structure, the natural lens in our eye that we're all born with, and over time, usually based on aging, but some medications can also cause this cloudiness of this natural lens. And then, as you see there on the picture, behind the brown part of the eye, the iris, you're looking at this sort of cloudy, milky-like structure, and that actually is a cataract that is needing to have surgery done.
So with those cataracts, I mean, that's got to be kind of painful, right? Do patients normally have pain or discomfort, or can they have one and not really realize they have one?
There's no pain with it. There's actually no pain fibers going to the lens. So the surgery itself is done topically. So we just use numbing drops on the eye, a little bit of IV relaxing medication for the anxiety factor, somebody operating on your eyes, you can imagine. But there's no pain with the cataracts developing. You just really notice blurring of the vision. Especially the biggest complaint we hear is glare at nighttime. So driving at night, you're starting to see these oncoming headlights, and as it hits that cloudy lens, that light doesn't go through smoothly. It scatters, and so people have a lot more issues driving at night.
Yeah, that's scary. That's got to be scary.
Yeah,
a little bit dangerous, I'm sure, too.
Most people say, "Well, I don't drive. I stopped driving at night," and that's a lot of the reasons that they decide to have the surgery.
Gotcha. Now, everyone that is watching at home right now, make sure, or not at home, I guess you could be watching at home. Maybe you're watching at work, maybe you're on your lunch break, whatever it is you're doing, leave us your questions in the comments. I've got my phone pulled up right here. We're checking out your comments as you're leaving them. So here is one of the questions we got from Ryan Patrick. He wants to know, is there anything you can do to prevent cataracts?
So cataracts are, to some degree, a product of birthdays. So everybody is going to develop cataracts at some point in their life. Now, again, just because you have cataracts doesn't necessarily mean you need to have cataract surgery. But the things that you can do to prevent it are lower the amount of UV sunlight exposure. People that are especially out on boats a lot and they don't wear protective sunglasses or are outside a lot, they are typically going to develop the cataracts more quickly. There's also some medications that will cause cataracts to form, such as oral steroids. People that have a lot of inflammatory issues are on oral steroids, and those people typically have a different type of cataract, but a cataract nonetheless that has to have surgery to be removed. Some of them are have a hereditary component, and usually people will develop them at a younger age if they have that hereditary component. But mainly, it's going to be aging.
Gotcha. Now that leads me to the next question. Rhonda Johnson-Lowry wants to know, my 12-year-old son was born with a cataract. Is that common, and will it cause problems in the long run, or will it need to be removed?
Yeah, that's a good question. So there are something called congenital cataracts, where children are born with these cataracts, and they go through screenings, or pediatricians are trained to look at their eyes and be able to tell, roughly, is there a cataract, is there not. And yeah, that can cause some major issues. If they're bad enough, they have to be removed when they are infants, and sometimes I've seen them removed as soon as 6 weeks old.
Wow.
The surgery for that is quite different from having surgery when you're older. Okay, so the entire technique is different. But they can certainly cause problems because you may or may not put a lens back in the eye at that young of an age. And so sometimes these little kids actually can have to wear hard contacts. And you think, how can I put a contact lens in a 6-week-old?
That is
and
crazy.
in order to do it, for them to see, you've got to do that. You often will have one eye that's weaker than the other if it's just in one eye, and you may have to patch the good eye to force them to use the recently operated on or bad eye. So it can cause some major vision issues long term by having it done. Gotcha.
Now I have a question that I read about. I think this one's really interesting. You've got icy blue eyes. I've got green eyes. I think Christina over here in the Weather Center has brown eyes. Are people more likely to get cataracts based on what their eye color is?
It's not really based on their eye color. You're not more likely to have cataracts if you have blue or green or brown eyes as much as it is, again, how much time you're in the sun is going to be a much greater predictor. How much time you're in the sun without appropriate protective eyewear is going to be a way more of a predictive factor than what color your eyes are.
Gotcha. Okay, cool. Now
And let me just say that if anybody
go for it.
has any other questions other than just cataract space, we're open for that. Any kind of eye questions that you've just been burning to ask.
Got you. So Holly wants to know, which we've kind of talked about this, or we talked about it on TV, does cataract surgery hurt? How long is recovery?
Both of those are good questions. So cataract surgery is, most of my cases are topically, which means we have a numbing drop that we put on the eye so the eye is comfortable. We have a little bit of relaxing medication we put through the IV. It's similar to the same relaxing medication you might get if you have a colonoscopy, but not quite as much. But there's no pain fibers with the actual cataract. So really it's just the incisions, and we're seeing here the actual the femto laser assisted cataract surgery, and we just use topical drops at that point. We also put some numbing medication into the eye once we open these little incisions up, and most people are very, very comfortable. The recovery time, only 24 hours of no lifting, bending, stooping, straining. We usually will see you back the next day, or your referring doctor may see you back the next day. If everything looks good, then really you can resume normal activities other than swimming. I tell people to stay out of the pool, or especially the bay, for at least a week after the procedure. But other than that, you can return to normal activity.
Gotcha. Now, someone asked earlier on if will wearing readers make cataracts worse?
No. They are, wearing the readers will not make the cataracts worse, or straining, or sitting too close to the TV, or like your mom used to tell you, your vision's going to go bad if you do that. That's not really the case, kind of a mom's tale. But the wearing readers or wearing glasses is not going to make it worse.
Gotcha. Now we've got a question, non-cataract related. Someone, Jessica, asked, what's the best for chronic dry eye?
Well, that is a big industry right now, and depending on, that question is loaded because it depends on why you have dry eye. So dry eye can be from the oil glands, which are on the eyelid, or not producing appropriate oil, and if you, the tear film is made up of water, oil, and a little bit of mucus, okay? You don't want much mucus, you want a good oil base. And so if you don't have good oil that's being produced, then the tears are going to evaporate very quickly. Some people don't produce much of the water or the actual tear, and in those situations, it's really important to figure out why you have the dry eye. The first thing that I start people out with is over-the-counter. I try to be conscious of the cost with some of the prescription dry medications can be pretty expensive, and insurance doesn't always cover them. But the first thing I tell people to do is start with preservative-free tears. These are not in a bottle. They are in these individual little plastic tubules. You can open it up. I tell also people to put them in the fridge. You put them in the fridge, they feel better, they're cool.
Ooh, that nice.
So start out with that. Start out with preservative-free tears. The ones in the bottle, especially the more generic brands, tend to have a lot of preservatives in them, and that can really be a big detriment. So people think they're helping themselves by putting these tears in, and they're actually harming their eyes because there's so much preservative in it.
Now, Marianne has asked, she said simply cost, which I'm assuming means what is the cost of this laser cataract surgery that we've kind of been talking about?
Right. So as we mentioned, insurance typically doesn't pay for the actual laser to be done. They will usually pay for the actual surgery, assuming your deductible has been met. There's a lot of factors. The laser by itself, using a regular lens with our group, is $1,500 per eye. Now that doesn't have to be done at once. We have some no interest issues that are allow you to spread it out over time. There's some other different types of lenses that we will implant along with the laser, and the cost changes based on what you decide upon there. And while there is cost involved, what I tell people is that if we do this procedure and we don't end up exactly where we need to be, I can go back and do a touch-up procedure, sometimes in the office, or sometimes even with LASIK, and get you where you need to be. And there's no cost involved with that because you've already kind of put that on the front end. We want to get you as good as you possibly can be.
Gotcha. Now, someone asked, Gail said, what are the symptoms of eye strain? Does it contribute to light sensitivity? So
light sensitivity can be, there's a lot of things that can be due to light sensitivity. Some chronic inflammation can be due to that. If you need to wear readers or need to wear glasses and you are not wearing them, you're sort of powering through, straining, squinting a lot, or if you're getting between the age of 40 and 50, typically people will get where they're not able to see as well up close, and that's when they'll have to go to the readers. And if you're sort of trying to power through that, holding things out a little bit farther, then you're going to be straining a little bit and kind of wear your eyes out. Also, if you are staring at a screen, this is a big thing I'm seeing a lot because we're all on our devices, is that typically we blink about 20 times a minute in regular life and regular conversation. And when we're staring at a screen, it goes down to 4 times a minute. So those tears are going to dry out, your eyes are going to dry out, and if you have a lot of dryness, that can cause someone to light sensitivity, even more so than if you think you just go out and there's bright lights. Cataracts can also, like I said, with light coming in the eye, you have a clouded lens there, it can cause some scattering of light and also result in some light sensitivity. So you just need to really get it checked out because there could be a lot of different reasons why.
Wow. So this one's kind of funny. Hello, Dr. Turner. This is Jean Turner. My maiden name is Turner, LOL. Next year I'll be on Medicare. I was thinking of getting LASIK surgery. Does Medicare cover that?
Getting LASIK surgery, no. And again, I want to make sure that we make a distinction here from what we're talking about. Laser cataract surgery, different than LASIK surgery. LASIK surgery is where you use a laser to, you can use a laser or a manual blade in order to make a flap on the cornea. You fold that back, you treat the underlying tissue and reshape it, put the flap back down, and that just changes you from your needing glasses prescription. But Medicare is not going to pay for that. No insurance. Some vision plans pay some, but almost none of them pay everything when it's regarding doing LASIK. And again, at 65 is a age for that. We also got to manage expectations because some people think, well, I can just get LASIK and then I'll be able to see distance and near and perfect and I won't need anything. And that's not always the case. So it's really important to have this conversation with your ophthalmologist in order to figure out exactly where you are and what you're wanting, if that's a possibility, or do we have to kind of, there's almost always something we can do to get you in a better spot, but it just requires that time to have a discussion.
Absolutely. Now we have someone that is saying, I have central, I'm going to say this all wrong. I have central, is it serous? Central
serous retinopathy.
Yes, and my doctor says there is nothing he can do. What would you recommend I do?
Well, the central serous retinopathy is in the retina, so it's in the back of the eye. And what happens here is typically you get fluid accumulation that happens in the macula, which is the center part of the vision, which you've probably heard of macular degeneration. And that's, the macula is just an anatomic structure, but it's the most important structure in the retina because it's the fine discrimination, central part of our vision. And central serous is where you have fluid accumulation that occurs there. So that's a really tough condition to treat. If you get rid of the fluid, that's obviously the first thing that you want to do. But if you have residual scars that are due to the long-standing fluid that has been there, you know, those scars a lot of times are irreversible. So the first thing I would say is make sure that everything has been done in order to get the fluid resolved. If it is resolved and the vision is still down, unfortunately that may be true. There's not much to do about that.
Gotcha. Now, someone asked, we talked about earlier, I think you said during the laser cataract surgery you can do one eye at a time if you need
That's
to.
Right.
Someone asked, how soon can the second eye be done?
Right. So we never do both eyes at the same time, and there's some safety risk in doing that. So we usually do one eye, and then as soon as 2 weeks, well, sometimes if there's a particular reason one eye is way different than the other, and the patient's going to be very off balance and very uncomfortable, we will do the other eye about a week later. But typically I like to wait about 2 weeks between doing the first and the second eye. Now again, they can wait as long as they like to after the first eye has been done, but usually my preference is waiting about 2 weeks.
Gotcha. Now, here on the Gulf Coast, I know we touched on this a little bit, but here on the Gulf Coast, it seems to be basically beautiful, sunny almost every single day, even when it's cold outside. So let's talk about how sunglasses can help with cataracts. Is there a certain type of sunglasses? Do we need to be using, you know, the real deal ones, or can my, you know, cheapy, goofy ones that are, you know, this big, can those work just as well as regular sunglasses?
Right. You want to make sure that they've got UV protection in them, because that's really the big thing. It's not just the light, but it's the UV wavelength that causes more of the damage and the protein deposits in the lens that cause the cataracts to worsen. And again, this is not going to be a one-time thing. You're laying out and you forgot your glasses. This is over a long period of time. But you want to make sure it's got UV protection. I prefer it have UV protection and be polarized, because that cuts down on a lot of this reflective glare that can also be a big problem. So polarized UV protection is what I...
Gotcha. Perfect. Now, this is really important for anyone that is watching with us right now. How do patients get in touch with you about evaluating if they're a candidate or they would like to have laser cataract surgery?
Sure. So what you would do is call our office. I'm in Daphne. That's we have office in Mobile and office in Daphne as well, and so our number is 411-9000. You'll call there if you have ever had or been told that you have cataracts and they're causing a problem. Then we could see you and evaluate you. If you just want to get in and see if you do have cataracts, then one of our eye care providers can see you as well and determine if that's your problem. Sometimes it may just be you need an update on the glasses, but they can determine if that's a problem, and then they would get you over to see me.
Gotcha. Now, someone just asked, can I get the laser done to relieve the pressure from glaucoma?
So this laser is, we say the word laser, and this is a little confusing for patients because there's about a dozen different types of lasers in ophthalmology. But the laser, there is a laser that can be used that can reduce eye pressure. It works on about 70% of patients. So again, 30% is not going to do anything. But that's an in-office procedure. If you have high pressure, it's not going to drop it if your pressure is 3 times higher than normal. It's not going to drop it down enough. But it can drop you down a few points where maybe some patients that are on a drop currently, and they want to see if they can get off of that drop, or if they're at the edge where they may need to be adding another drop to the mix and they want to say, look, I really don't want to add another medication to my list. Let's try this laser. If it works, great. If it doesn't, you haven't really lost anything. The risks are very low with doing that procedure.
Gotcha. Now, just while I have you here, say that there was you know, like maybe someone that's mid or late 20s and they've had contacts since they were in like 4th grade and like glasses since they were in 2nd grade. Their vision's just terrible. But their prescription hasn't changed in a couple of years. Is it time to start discussing LASIK surgery, or how frequently should they be visiting, you know, the ophthalmologist or anything like that?
You know, they at least need to be seeing an eye care professional, either an optometrist or an ophthalmologist, at least once a year if they're in glasses, and make sure that there's not a big change or anything else going on there. But if they've been wearing contacts, been wearing glasses, you know, and they're just tired of that, or they have an intolerance to the contacts, then LASIK is a really good option. Again, as I said, this is an office-based procedure that takes about 7 to 10 minutes per eye in order to do. We have really very successful surgery. Now, not everyone is a candidate for that, so that's why it's important to, you know, ask your eye care professional, whoever you're seeing, who they would recommend if you want to get an evaluation. It's very, very important that that person sits down and really looks over everything and talks to you about what the options are, because not everybody is a candidate. And in fact, there are some people that should not have the surgery at all because it can make things a lot worse, and that may end up causing them a lot of problems down the road. The biggest thing is dryness. If you've already got really, really dry eyes, LASIK is going to make your eyes drier. So you've got to know that going into it. And if somebody just says, oh yeah, you're a candidate and you've had a lot of dry eyes, I would say really be aware of that, because not all LASIK surgeons are created equally, and beware of the discount LASIK, because they're, you know, they're skimping somewhere, either in the time in the chair with you to have discussions, on the examination, or in some of the equipment. So while we do LASIK, you know, it's not the cheapest out there, but there's a reason for that, because the quality that you're going to get from that is going to be superior to someone trying to discount it on the side and not really have your best interest in mind.
Absolutely. I mean, you get what you pay for. So that makes perfect sense. That makes perfect sense. Now, you are going to be back here with us on April 6th.
Right.
Do you know what you're discussing?
I think what we're going to actually talk about, and you led into it great, is doing laser LASIK surgery.
Oh, cool.
So again, as I mentioned, there's 2 different ways to create this flap on the LASIK. Either with doing LASIK, either using a manual, it's called a microkeratome, which is a very fast-cutting blade, or we can actually use a laser in order to do that. And we've just started doing that. Even can do that in our office over in Daphne.
Perfect. So in the meantime, you will be over in Daphne, Premier Medical. For anyone that's watching that wants to get in with Dr. Turner, like we just said, Daphne, Premier Medical. Go ahead and give it a call, set up an appointment, do whatever it is. And make sure that you join us again on April 6th, where we will discuss LASIK. Thank you so much for joining us this afternoon. And thank you, doctor, for stopping by and talking to everyone. And we will be with you momentarily on News 5 at 5. So make sure you join us then for the latest headlines for today.